Tuberculosis is still the number one killer, preventable disease here in Papua New Guinea, and it's frightening, lest we forget. We discussed this on the eve of the celebrations or commemorations of the World TB Day this week. And here with me in the studio, I'm privileged to have with me Teresa from the Business for Health here in Papua New Guinea. Madam, welcome to the program.
Thanks, Bradley.
All right. So we're talking about tuberculosis here. First of all, tell us about the work that you do here in the country.
Okay. So I've been in the TB program for this past 5 years, working with the government, and now I'm with Businesses for Health. So basically what I do, I'm a health extension officer, and we help to manage TB cases in our workplaces in the private sector. So TB does not discriminate. We have TB cases in the workplaces too, and we try to get these people who are affected by TB on treatment and they don't lose their jobs. So we help to manage the TB cases in the workplaces and they get to finish their treatment successfully. So that's what I do. We also conduct awarenesses for TB in the workplaces, yes.
Okay, good. So let us understand a bit more of what the organization you work for actually does here in the country.
Okay, so Business for Health is a non-government organization. So B4H, like what I've been doing as my role, so we try to manage TB cases in the workplaces, and we do that free for business houses who subscribe to the organization. And we help the HR in the workplaces to create a TB policy so that they have a policy to guide them when an employee is affected with TB, they don't lose their jobs because this person might be the breadwinner of the family. So that's one of the main things that we do is getting the HR to have a TB policy in the workplace and to have somebody who is infected with TB to be on treatment and completing their treatment, and they don't get to lose their jobs. Yes.
All
and
right.
apart from that is the awarenesses that we do. We have to constantly talk about TB because it's a crisis here in PNG.
All right. Plenty time you may talk prison liglig. Plenty time you may talk long TB or tuberculosis. Plenty line only ting all sem dysplastic emblong or liglig man tasol. Tasol statistics si soy mol sem all man tu eli walk long all big pla company tu isabek sim dysplastic na you story liglig lob mi plalong. Online way you pla walk one time halivim all na oli kisim halivim marasin na all still go to walk.
Now. So you may bating was pamikim one pla good pla story, yeah. Blow one pla Mary walk lo one pla airlines. Okay, so nice pla Mary. You know, Mary's walk lo airlines, they are beautiful, and you would think that somebody who is beautiful and who has a job at a prominent airline would not have TB. But yes, this la kind of something you make him na this la patient them no come out hurry up lo kisim halivim. So she came at a later stage of having TB, but in the end, she was treated and she went back to work. So, what was the question again?
Yeah. So, I think you clear along you may also TB sa discriminate also mito.
Yes.
Am sa kamablong all get a man long, all get a part long society too.
Yes. Now. So yes, TBMM no stop ta solo community. By meeting ta solo TBM plus settlement, but no. Even all big pla offices tamlo downtown, we got all TB cases. And yes, we have helped many people in big offices who had TB get treatment. Yes.
So okay, you may talk liglig long TB, tuberculosis. Tuberculosis M1M something for the little people watching out there. How do we explain this to them?
So TB, short for tuberculosis, one plastic where sa affect him lungs blow, you mean. So first when you are infected with TB, sa sit down lo lung blow, you mean, but BNM sa go out lo narapla part of the body. So TB can affect any part of our body, not just the lungs. So it's the TB of the lungs that is most infectious. When somebody coughs or sneezes, and can spread him sick. Igol ol narapla, usati stop close to long him. So suppose me got all poorly ventilated, all house blew me, no got wind, no got sunshine, he come inside long him, all offices blew me, all poorly ventilated. Those things, they contribute to the transmission of TB from one person to another. So yes.
All right. So look, good plo discussions me plo walking long tuberculosis this week by me thinking back long tuberculosis walk where all workman Mary walk long walking inside long country. Now how you and me can contribute long side long stop him displacing inside long Papua New Guinea. By mixim sort pla malolo long displaced na come back long narpe side one time more long all discussions long you me long in focus. Welcome back to Infocus, discussions on health, and specifically tuberculosis. Now, I still have with me in the studio, Businesses for Health, Miss Koratsi here with us on the program. Look, before the break, we spoke about, tuberculosis here in Papua New Guinea, but also present with us is COVID-19. In the last 2 years, how has it been like? Has it affected the work that you have done for your organization in as far as, addressing tuberculosis, your awareness programs? Has that sort of affected your work?
Yes, definitely, Bradley. Work blow me apply inside law, Businesses for Health, me talk pini sem blow go out na work in awareness blow TB na this lakain. Through COVID-19, come up this la pandemic, affecting you me even us. So one plus way we been affecting me apply was Post-Mary Blompla, Dr. N. Clarke stranded law Australia because of the border restrictions, and she was not able. So we had, during this past year, we've been having Post-Mary deaths remote. Another plus something too, you may look at small business houses, which me plus I work one time all. Their focus has shifted because you may all get in pandemic, and we're trying to reduce the impact of COVID-19 inside the PNG. You may look at some focus and go to COVID-19. So before you may give him all awareness plus TB, now you may talk COVID-19 that's all. So even though we try to focus on that TB, our focus has shifted to COVID-19. So in that way, pandemic affecting work this way. So we still had companies, businesses working with us, but now their focus has also shifted. So for this year and for this week, like World TB Day coming up, we want to bring back the focus to TB and tell the people the 4,000 cases that you miss looking also die lo one playa lost sick TB. We want to come back and focus on that. The number of cases inside lo PNG is like 38,000. It's still there. Each year we have that number of people being affected with TB. And inside lo NCD, there are 6,000 cases there. Online blame lo workplace. So that's where Businesses for Health come in law, trying law. Still keep that focus on TB, even though we have the pandemic. Now it's the new normal. So we try to do the normal, but TB is still there. It's killing a lot of people in PNG.
All right. So at the same time, what we're telling people is that, if you're even more, harsher, if you have tuberculosis, there's another recipe for disaster when COVID-19 also comes in.
Yes.
But look, tuberculosis is still around in the workplaces that you've been doing this work. Now because of the COVID restrictions, have you been moving freely in and out to actually talk to the patients, conduct awarenesses? How has it been like?
Yes, same now. I'm one way to COVID-19 been affecting me because business houses want to keep their workplaces free of COVID-19. There's been so many restrictions, and some companies have been saying that we'll talk on Zoom, or we can't go to the workplace because of the COVID-19 restrictions. Yes. So in that way, too, it has affected us.
But the other thing is they don't realize that tuberculosis too is an airborne disease,
You know.
similar to COVID-19. So a bit of irony there. In terms of the medical drugs to support this here in the country, has it, from your point of view, is it adequate at this time?
Yes. There's all TB patients where step inside the workplace, they still are on treatment. There's treatment out. There's still medicine and TB services are open to the public still in the government facilities. Even though it's been disrupted a bit inside the last player time pandemic can come, but we want to ensure the public that the TB services are still functioning. There is treatment available, and if you are coughing and having some of the symptoms for TB, then please go to the nearest clinic to you to get the service that is available there.
All right. So how do you get to patients, or how do they subscribe to the Businesses for Health? Can you just elaborate on that?
Okay, so it's either we give them a call, we see a potential business, and we give them a call and offer them our services. So usually we work closely with the government facilities, other TB clinics. So it's usually from the TB clinics, they give us a call and say, hey, we've got somebody who's working at this so-and-so company, and we would like you to assist. So if we see that they're not subscribers to Businesses for Health, then we give them a call, talk to the HR or talk to the manager of the workplace and try to get the policy in place and help this person who has been affected with TB.
Okay.
Yes.
And so far in the country, have businesses seen the importance of, doing awareness to the staff or being part of, such arrangements? Is that so?
Yes, it is. We still, every year, we still have workplaces reaching out to us to assist them with their policies and as well as the TB cases. TB does not stop. It affects everybody daily. So we still have businesses, yes, workplaces, they're still calling out and they see the potential that like an organization of ours can help. Because helping somebody with TB, it requires a certain kind of skill. So we try to not only do it ourselves, but to ensure that all man marry inside the workplace, all employees, they do have that kind of skill. Because the nurses and the doctors cannot come out and do it. We ourselves have to know to help our own employees be on treatment.
Right.
And we reduce the impact of TB.
Final one from you on the commemoration this week of World TB Day.
Yes. So the 24th of March, which is Display Test Day and World TB Day, so one all organization all oklo working all celebration all. Mi pla ba work boom one time the NCD Provincial Health Authority. Mi pla ba work boom one time all na make him commemorate in World TB Day. So on the 27th, which is on a Sunday, the Governors Walk for Life. They will do that for TB. So ipla can come out na join him ipla lo disla time lo yumi walk boom one time lo kirap him disla walk blo TB beken inside lo NCD but also to PNG. So the Walk for Life is on the 27th. On the 24th itself, we are doing something with business houses to commemorate the day itself too.
Yeah, thank you very much for coming on to the program, Ms. Koratsi, and we wish you all the best in the commemoration this week.
Thank you, Bradley.
All right. On the other side, I speak to Dr. Anne Clarke. Stay tuned for that. And you're back to Infocus. This time around, I'm speaking with Dr. Anne Clarke, who joins us from Australia. Doctor, thank you very much for joining us on the program. Look, we've been talking about tuberculosis for a very long time, just recently because of COVID-19. Some disruptions there. Should it still be in the topic of, in the discussion forums? Should tuberculosis still be there? We understand it's the #1 killer disease here in Papua New Guinea.
Thank you, Bradley, and it's fantastic to be speaking to our friends in TB again. Thank you for the opportunity. I think World TB Day in 2022 is more important than ever before. Well, certainly more important than it's been for the last 5 years. In PNG, before the arrival of the coronavirus and the global pandemic, PNG was making progress at improving case finding and finding people with tuberculosis. Worldwide and in PNG, progress against targets to find, test and treat cases of TB has been stymied and been distracted by the whole world fighting the coronavirus. The big difference for PNG is that PNG, not every country faces a TB crisis the size of PNG's. And if we say that there are about 170 countries in the world, 30 of them have the world's worst rates of TB, and PNG is one of those 30 countries. In Australia, we don't talk about TB. In PNG, our closest neighbour, we have the world's worst rates of TB, and coronavirus has disrupted the conversation. It's made providing services and access to everything more difficult. The big thing about tuberculosis is if people who are sick think that services aren't available because of the coronavirus, or they think that there's a riot, or they think that there's going to be a complaint, or that they think it's not safe, they won't turn up. And it's not just about disruption to services and money, it's about the loss of confidence in thinking that services can be accessed and cures are at hand.
All right. So I think, Dr. Clarke, what you're talking about is the discrimination is still there with regards to tuberculosis.
Absolutely. Absolutely. And Teresa and I were talking about this yesterday. If people think that TB only affects poor people, if people think that only people from the settlements get TB, then they are ignorant of the facts. In PNG, 40,000 people have tuberculosis. They do not all live in Madang. They do not all live in Mount Hagen. They do not all live in one particular place. Over 6,000 of them live in the NCD. So you and I know that if 6,000 brand new red cars went onto the streets of the National Capital District, by the end of the day, everybody would have seen one of those new red cars. They are everywhere. So TB cases, when there are so many, come from the wealthiest workplaces, from the wealthiest families, right out to the places on the edges of the community where they have poor access to services. TB does not discriminate because it is spread by breathing, and we all breathe.
But why do you think it's still been it's still discriminatory, amongst the working class people? Is it because of the fact that predominantly in the past it was linked or associated to poor people?
I think it's the association with being poor. And just to add to that, if I go back to my mother's generation during the Second World War, those perceptions persist in the mind of many senior managers who are like me, whose grandparents and parents were affected by TB in the 1940s. And there was an association with the slums of London and things like that. But even then, it wasn't necessarily true. My grandfather died of TB, and he was a surgeon. So those things are that's one thing. But what fuels stigma more than anything is about ignorance of the disease itself. And if a boss or a workplace thinks that TB cannot be cured, or TB is quickly going to be spread through the workplace, and the boss sacks them out of ignorance of understanding how TB is tested and treated in 2022, that person loses their job and goes and makes more TB cases at home. And if someone is scared of losing their job, they will remain silent and they will do whatever it can to help maintain the income for their family. So if a person is scared of losing their job, it becomes stigmatized, right? Because fear. So the work of Businesses for Health is to make sure that at the very highest levels of every workplace, people understand the mechanisms for talking about TB, for how quickly and effectively it can be tested and treated. Because there are many people who do not understand that in 2022, people can come back to work quickly, that the workplace can support them to complete their treatment. Because if under the old system where, oh, he's got TB, I think we better sack him, all they serve to do is to make people lie and be scared. And worse, it makes for more TB when that person is so sick they cannot work anymore. And as Teresa, I know, talked about, a person sick with TB is an unproductive person. They cannot work to their full capacity.
All right. Look, the prolonged duration of treatment, do you think is one cause why some businesses will be afraid of keeping patients with tuberculosis in the workplace, for that matter? And how many organizations that you've worked with actually have TB policies in their workplace?
The nature of the new TB treatment means that a person with TB becomes non-infectious very quickly. And most people don't understand that because they are afraid of getting TB. So the faster that a person can return to work and ask for support to complete the long course of treatment. Our mission in 2022 is to have the wealthiest companies in town support our project, to have all businesses in town subscribe to our program of educating their staff to better serve not just their staff, but their customers and their families and their communities. So I'm very grateful for this opportunity. Most importantly, I want to hear everybody singing our World TB Day song and walking with the Governor and our team on Sunday the 27th.
All right, thank you very much for your time.
Thank you.
This has been In Focus. If you have comments on tonight's program, you can email us on the email now showing on your screen, or you can engage with us on our social media pages. From all of us here, stay safe, pleasant viewing. Bye-bye.